I'm going to share the success stories of the containment and control of COVID. So my objectives are to review the successful responses and share the international experience, lessons. The overall aim is really to empower ourselves and the people so that we can have an effective public health response to the pandemic. This is a model of the coronavirus, which is known as SARS-CoV-2, and it causes the coronavirus disease. We now have over 2 million reported cases globally, with over 140,000 deaths. And most cases have been reported from the United States, well over 500,000 cases, 34,000 deaths. And in various European countries, there have been over 100,000 cases reported in these countries, and thousands of deaths. The overall death rate is about 7%. However, it's quite likely that the true number of cases are much greater, that the number have been underestimated, and therefore the death rate is probably much lower than 7%. Now, Germany, you will see here, has a death rate of just 3%, and this is because they acted very proactively, as well as you will know that their leader ensured that only 2 persons from separate households could be outside together in public. So they really restricted the mingling of people. This is the epidemic curve in China up to the late February. And the first curve in blue is really it's done by the onset of symptoms, the date of onset of symptoms. And the second curve, further to the right, is by the date of diagnosis. So you notice there's always a lag period between the diagnosis and the actual infection, when the infection takes place. So the epidemic is always ahead of what we are seeing. Now, the joint WHO-China report that looked at the epidemic in China said that China rolled out, and I'm quoting from the report, perhaps the most ambitious, agile, and aggressive disease containment effort in history. They had universal temperature monitoring, masking, and hand washing, suspension of public gatherings, stay-at-home requirements, travel bans. The people were very disciplined and adhered to the containment measures. But what many people don't realize is that they had massive mobilization of thousands of volunteers to help. So their bold approach changed the course of the epidemic and gained time for other countries to prepare. And China's experience provided vital lessons to the rest of the world. Now, local officials in China may have been slow in reporting the outbreak initially. However, the Chinese isolated the virus causing the disease, and within 1 week were able to sequence the genetic code, and they shared it internationally. So they were able to develop diagnostic tests rapidly, but within 1 week, a company in Germany was able to also come up with a diagnostic test because of the sharing of that genetic code. There was aggressive contact tracing, testing, quarantine, isolation, and treatment. They were able to build 2 new hospitals in 2 weeks. They set up isolation areas in stadiums and gymnasiums. And there was a total lockdown of Wuhan, 11 million persons. Now, when they realized how aggressive the epidemic was in Wuhan, 40,000 health providers from throughout China volunteered and were mobilized to help in Wuhan. And they were isolated, they stayed in one place, they worked round the clock, and not one of those health providers became infected. Other health providers in the early part of the epidemic did become infected, but none of the 40,000 that we're aware of. They used thousands of volunteers to do things like fever surveys, contact tracing, and volunteer in other ways. So there was significant task shifting, and 15 million people had to order food online, and it was delivered by volunteers to their homes to show the extent of the mobilization of the people. Of course, there was significant use of technology and research. What did we learn from the epidemic in China? We are all susceptible. Cases among children are rare. Young adults rarely get seriously ill. It's the rare person who is young who gets ill. Most persons will recover. Some persons, although they recover, they may remain infective up to 37 days. The elderly are the ones who are most at risk, especially those with comorbid conditions. Health providers caring for persons with COVID must take special precautions. The clinical features were described, primarily fever, cough, fatigue, sputum, shortness of breath, sore throat. Now, it varies a bit in different countries. Some countries have more GI symptoms, nausea, diarrhea. So it does vary. And in more recent times, we are seeing that one of the early signs is loss of sense of smell. It may be the first symptom of COVID. Now, 80% of the cases in China were mild or moderate. 14% were severe, and 6% were critical. It was among the very old, those over 80 years of age, 22% of them, unfortunately, who became ill and had to be admitted to hospital, actually died. But most persons, in fact, will recover. Again, in China, we were able to identify the clinical course of infection. On average, the incubation period is 5 to 6 days, but it can be up to 14 days. Now, since then, through international experience, we've learned that persons can be symptomatic 2, possibly up to 3 days prior to them developing symptoms. So we know the measures to prevent the spread of the disease. Good hygiene, hand washing, sanitizing, cough etiquette into your elbow, cleaning the services, suspending any events with crowds, physical distancing, wearing of masks, intensive contact tracing to identify cases, quarantine, isolation, and of course, making sure that health providers have the personal protective equipment. And just like in Wuhan, total lockdown when needed. The transmission dynamics of the virus, we are still learning about it. It's primarily person-to-person spread, and spread is usually from persons with symptoms. But we are seeing now that people with minimum symptoms or pre-symptomatic, so they've not developed symptoms yet, these persons can transmit, and of course from touching contaminated surfaces, because the virus can live on surfaces from 2 hours up to as much as 3 days. Now, there are many lessons. I've emphasized those from China. There are many lessons from different countries. I'm going to touch on South Korea. South Korea had the experience of dealing with SARS about 15 years earlier. So they had been through that kind of epidemic. And they had early recognition and moved very proactively, fast, before it became a crisis. They tested early, often, and safely. They did contact tracing, isolation, and surveillance. They used technology. They used cell phones to help them with contact tracing and alerting persons who may be at risk because they were exposed to someone who was found out to test positive and had the infection. They enlisted the public's help They controlled their borders and tested people coming in. And of course, they reassured and educated the people while fighting misinformation. Now, there's a story about two towns in North Italy. One of the towns was called Vo, and they tested all 3,300 inhabitants. Now, I'm not giving you the exact numbers, but approximately 100 tested positive, 3% of the population. And they found that of these 100, 50 of them were asymptomatic. So the early testing and action to quarantine and isolate helped to control the spread in Vo. In another town in North Italy, where there was minimal testing, it resulted in significantly more cases. So the importance for us of aggressive testing, we must test all suspected cases, all close contacts, whether the contacts, once they're close, whether they're symptomatic or they are asymptomatic, they need to be tested. All patients with pneumonia, persons who have any of the symptoms that could be consistent with COVID, influenza-like symptoms, these people need to be tested. And of course, frontline workers. And then the final message is the importance of international solidarity. And the WHO report in China made the point that true solidarity and collaboration among nations is essential to combat the common threat of COVID. Information has to be shared rapidly. Now, the World Health Organization sounded the alert early and advised countries repeatedly to act. The WHO has provided a whole range of superb technical advice, resources. In Jamaica, we got our initial testing kits through the help of PAHO and WHO. And they've been doing this internationally. Countries must act to support each other and one another. We have to share the lessons that we can learn from controlling and containing COVID and ensure that all countries benefit from the technology, tests, and any new treatment and vaccine that is developed. Now, just a couple other examples of solidarity. We were able to get help from Cuba with nurses and doctors, ICU nurses. A team of doctors from Cuba went to Italy to help them when they were under stress. There was a millionaire in Asia who sent supplies over to Latin America, South America, to help countries there. So it is important that we recognize that we're all in this together. And those of you who have seen the scenes in Italy when people come out in the evening and together sing, and throughout the world, in the United States, in Italy, in Europe, in other countries, people come together at particular points to pay tribute to the frontline workers, the healthcare providers. But it's not just healthcare providers who are on the front line, all the frontline workers, to offer solidarity to them because they are taking the brunt of the response, and we all need to support them. Thank you.
Thank you very much, Professor Figueroa. I like the point that you make that we're really in this together, and this is a pandemic, and by the very nature that it affects all countries worldwide, that we can share and learn from these experiences. I recall the governor of New York talking about one state helping another with ventilators because it's moving at different phases. So as you no longer need your ventilators, maybe another place can use it. So I think that's the philosophy that you're sharing here. So certainly I think the question about testing comes up again. Now, it was raised before by Professor Celia Christie and Dr. Joshua Nzinga. And you quote the story of the town or the city of Vo in Italy. And perhaps I can ask you, in the context of given the cost of testing, Dr. Anzinger shared with us this morning that molecular type tests are very expensive. If I hear the success story of VO that you're presenting, there seems to be a case where you say if we test early and we test everyone, that there's some benefit in understanding the nature of the epidemic in that particular setting, and we can take action to follow. Are we at a point where we can talk about cost effectiveness of such a strategy, given the kinds of tests we have in the market, and the call for a public health approach that may say early and wide testing is of value? Could you say something about that, vis-a-vis, cost and effectiveness?
Yes, I think this is a very important question. And at this point, the tests are quite expensive. They're labor intensive. It takes us at least about 8 hours currently to do this test in Jamaica. And if you do it from the time when the swab is taken, getting to the lab, and then done, sometimes it's 24 hours before you get the result. In Wuhan, in China, after several weeks of doing this, they managed to get the testing time down to 4 hours. Now, what I am hoping is that given the technology, and many companies in the United States, Europe, China, and in Asia, that they're going to be developing tests that will become less expensive, they'll become more rapid, and these kind of tests will help us to do, hopefully, point-of-care testing. In China, they used to get the person to wait on the result before sending them home, so they didn't send home anyone who was positive. Now, if we have to do our best with testing, with what we have, hopefully we'll get more rapid tests. But there's another approach that we can take, which will help in part, and that is we can use a clinical definition, case definition. So anyone who has symptoms that are suggestive of COVID, let us act as if that person is positive, so they can self-isolate at home, wear a mask, ensure that household persons are not in close contact with them, although they are supporting them. And we can use this clinical case definition so that people take precautions up front. Also, because we know people could be infected before they develop symptoms or even are asymptomatic, when we are in public, we should behave as if we are infected. And therefore, it would be better to maintain the social distancing. Once you go into a crowded place, public transport, put on a mask, hand wash, sanitize regularly. So we have to adapt to our resources and situation to deal with it, even while we await and hope for less expensive, rapid technologies to support us.